Hi everyone, my name is China Kuiper, and today I want to make a PSA on NATA's prevention and treatment of different skin diseases. So, our number one question here is how do we prevent a disease or infection from spreading from one individual to another? Well, to prevent that, the number one tip I think we can take away from the paper and as well as this video is just having good proper hygiene. So that could mean just washing your hands for 20 seconds with antibacterial soap before and after treatment so that we're killing all that bad bacteria we exposed ourselves to. And even if we are wearing proper PPE, sometimes when we're throwing them away, we can get it on our hands, and so we just want to make sure that we are properly cleansing and getting rid of that so that once we go to our next athlete and perform their treatment, that we're not exposing them to that bacteria. And the second step that we can take is educating our athletes, coaches, and in being in constant contact with our maintenance crew. Because if we notice that one of our athletes has signs and symptoms of this infection coming on, to be preventative, we can talk to them so that they can come in and clean the clinic with more of aggressive sanitation so that we know that it can stop the spread of any infection within the clinic so that no one else is exposed to it. And also, to educate our athletes, we can tell them that, hey, take a shower before you come into the clinic after a game or practice because we don't know what type of abrasions or cuts they might have. And we just want to make sure that all that dirt, grime, and any outside environment bacteria does not come into the clinic, especially when you're going into the whirlpool, because sometimes a lot of them go in together and we don't want them just sitting in all that water and bacteria just so that one person can get infected. Because what we learned from the paper is that a lot of the reasons why infection spreads from athletes is that they can share towels, equipment, and a lot of the spaces that they are in are shared. So we want to make sure that our clinic, we are cleaning and sanitizing the tables, the chairs, the equipment, and that all those towels that we are using go into the hamper and that we're washing at the end of the day or throughout the day to make sure that we have enough towels, clean towels, so that our athletes can use them and not be concerned if they're going to get something from it. We just make sure that everything is always proper and clean, and that at the end of the day that our maintenance is doing what they're supposed to with their things. So that's why it's good to always have constant contact with them. And one of the other things I'd like to add is the types of skin diseases that we will probably be most exposed to as athletic trainers is bacterial, fungal, and viral. And bacterial is probably going to be the most common because that can come in the form of an ear infection, a cold, and um, even acne. So they might have to take antibiotics if they cannot contain it with an over-the-counter drug if we do not catch it early enough. So we can do that. But the antibacterial, it can sometimes be too broad and it can kill the good bacteria as well as the bad. And sometimes if the bad bacteria is so aggressive, it can take over, and then that's when we start getting into the viral infection side of it. So we want to make sure that we are trying to be preventative, because once they get into that viral, then they're gonna be like vomiting and all that, and that will have to be some type of different prescription because it's going to have to be more narrow instead of broad. So we're going to have to really single out what the viral infection is to give them the proper treatment. And fungal, that happens with it can happen like athlete's feet or even ringworm, and that can come from equipment. It can come from just the environment. So like athlete's feet, it can come from a very moist environment. So say your shoe and it's just old and you've been practicing for hours and you haven't switched out your socks, and you just have a predisposition to sweat more and your glands are just bigger, so that can predispose you to that. And those can usually be handled, the fungal, with over the counter or topical or oral administrations um, to catch it early. So, with that being said, I hope this helps and see you. Bye.